Hi, I'm Betsy Nicoletti from codingintel.com, and I am recording this short video today to describe the rules related to interprofessional telephone, internet, electronic health record consultations, but I've abbreviated that to interprofessional consults on the title slide. So when these codes came out, and I'm going to look and see what year they came out in, 2014. It was shocking to me to see that there were codes in the CPT book that didn't require that the patient be seen, but that it was an interprofessional consult from one healthcare professional asking for a consultation from another healthcare professional. And shocking to see that they are now active codes and that we can use them. They have been for a bit. So there are 5 codes for use by consulting physicians and other qualified healthcare professionals. And when these codes were first developed and defined by the American Medical Association, these 5 codes were only to be used by a consulting physician, but they added other qualified healthcare professionals in there. And who are we talking about? We're talking about people who have E&M in their scope of practice. Advanced practice registered nurses, PAs, someone who can do an E&M service. I wish the AMA and Medicare would get together. The AMA calls them other qualified healthcare professionals and abbreviates it as QHP. And Medicare uses the term non-physician practitioners and abbreviates it as NPPs. There's also a code for use by the treating physician who are getting information together to request a consultation. So this is work we're doing through our electronic health records, not face-to-face. So the first thing is Medicare says that you have to get verbal consent. So this is the first stumbling block in performing these consultation services, because the consulting physician is not, or NPP, is not seeing the patient. Their staff member isn't seeing the patient. The patient's not coming into the office to register. The service is being done entirely electronically. So who's going to get verbal consent? As I think about it, the only person who can get verbal consent is the requesting physician. And I think that's a hard sell. I'd like to have the neurologist look at your record and give you some advice. She doesn't need to see you, but she'll charge you for a medical record consult. Is that all right with you? So when we're talking about consent, Medicare says that we need, so the CPT book doesn't talk about consent, but Medicare says that you can get consent verbally or in writing, but that the consent needs to be documented in the medical record, and that you can use one blanket consent for all of these non-face-to-face services, online digital assessment, the care management, and update that once in a year. But for this, I think this is a stumbling block, let's just say. So there are 4 codes in this series, and they vary by time. So here's that big, long name: interprofessional telephone, internet, electronic health assessment and management service. So if it's administrative only, I'd like to transfer care to you, I want you to follow up and see this patient. No, it's a health assessment and management service provided by a consultative physician or other qualified healthcare professional. And this is my underlining, of course, not CPT, including a verbal and written report to the patient's treating requesting physician or other qualified healthcare professional. So whoever asked you to see the patient, you have to provide a verbal and written report. And here we got 5 to 10 minutes of medical consultative discussion and review. And you can see the RVUs. Same RVUs for facility and non-facility totals. I could have put them in one column. Then we have 3 more codes: 11 to 20 minutes, 21 to 30 minutes, and 31 minutes or more. Now there's one other code, 99451, It starts out the same. It's this evaluation, assessment and management service, including a written report to the patient's treating, requesting physician, or other qualified healthcare professional, 5 minutes of medical consultative discussion and review. And I'll talk about the difference between them in just a minute. So for these 5 codes that I've just mentioned, a physician or other qualified healthcare professional can use them. It may be a new patient to the consultant or an established patient with a new problem or an exacerbation of an existing problem. The consultant can't have seen the patient in the last 14 days. And if there is a face-to-face service in the next 14 days or the next available appointment, you can't bill the interprofessional consult codes. So if as a result of this internet medical record consultation, the neurologist said, you know, I got to see this patient, have them call my office and make an appointment on Monday, then we don't get to bill the interprofessional consult codes. For the first 4, where the time goes from 5 to 10 minutes to 31 minutes or more than half of the time must be spent in medical, consultative, verbal, or internet discussion. So half of that time has to be spent in verbal or internet discussion. So we know what verbal discussion means. I think we can include documentation in the internet discussion, but I'm not sure. It could be just messaging. Only 99451 may be used if more than 50% is in data review and analysis, and that's only a 5-minute code. We're not allowed to report these more than once in a 7-day period. And of course, we need verbal consent. The verbal consent the verbal or written consent has to be documented in the medical record. You've got to document time in the medical record. Whenever we use time to select a code, time has to be documented. We have to have a verbal and written report given back to the requesting clinician. For 99451, you don't need to actually talk to the requesting clinician. A written report only is required. It can be done in a facility or non-facility setting. And you have to document it, and it's got to stay as part of the permanent record. The written or verbal request should be documented in the medical record. And I was asked recently, where does it say that? And it says that right in the CPT book. So although only Medicare talks about consent, CPT says that a request, the written or verbal request for the consultation, has to be documented in the medical record. And that's like the rule, it's more than guidance. That's like the rule that they've always had for consultation services, that the request could be verbal or written and needs to be documented. So now I'm going to switch gears to a 6th code, which is used not by the consulting physician or non-physician practitioner, but by a treating physician or non-physician practitioner. Interprofessional telephone, internet, electronic health assessment and management services provided by the treating requesting professional or other qualified healthcare professional, 30 minutes. Now, if you remember 99451, it was 5 minutes with these same work RVUs of 0.7. So in my opinion, they're significantly undervaluing the treating physician's time. Can be billed by a physician, NP or PA, 16 to 30 minutes because we're going to use the midpoint rule. May not be reported more than once in a 14-day period. It has pretty low RVUs for 30 minutes of time. Here's my editorial comments: undervaluing primary care work. So interprofessional consult, you can consider these codes when physically seeing and examining the patient is not required when you have this request from another healthcare professional. And we're going to have to ask the requesting clinician to obtain verbal consent, or maybe you have your office call the patient. But somehow we've got to get consent, and the verbal or written consent must be documented in the medical record. So here are the pitfalls. Is consent documented? Is the request documented? Is there a written and verbal report? Is time documented? So thank you for joining me today. It's a pleasure to talk with you. And there are more recordings, more video recordings, brief, on both codingintel.com and on YouTube. And I hope that